Oral and systemic health are indeed inseparable. The mouth is the entry point to the body, and we know that when you have gingival and periodontal inflammation, it's like an open wound. And so that communication through the bloodstream with the rest of the body is critical. Prevention really becomes more important. Not only is it important for prevention of gingival inflammation to prevent periodontitis developing, but it's also now important to prevent gingival inflammation because of its impact on systemic health, and to prevent periodontal disease or periodontitis more specifically because of its impact on systemic health. We now have sufficient evidence to be able to have a conversation with patients primarily about prevention, but we can also bring into that story and that narrative the importance of preventing periodontal diseases and periodontal inflammation for their general health. Yeah, so we now are very aware of the economic burden presented by gingival and periodontal inflammation from work by the economist Impact in particular, who've modelled this. The financial impact is so large, it's become very, very important to recognise that the traditional view, which was mechanical plaque control, is not sufficient for every patient. And we don't take the patients who cannot achieve the standards required for stability, periodontal health and stability, we don't chuck them on the scrap heap. You know, we have to come up with alternatives to help them reduce that inflammation. And chemical agents, we now recognise, specific chemical agents can make a big difference in reducing gingival inflammation and also in reducing dental plaque biofilm levels. And so for those patients who struggle to achieve with manual cleaning alone, we need to start considering the use of adjunctive chemical agents because it's about reducing the inflammation. For some of the profession, I should say, mouthwash is considered a dirty word, and that is because historically we were very evangelistic and purist about reducing gingival inflammation and reducing periodontal inflammation. We now realise, because we have sufficient evidence from systematic reviews, that actually chemical agents in mouth rinsers do in fact provide adjunctive additional benefit. And I think the reason that we have struggled is because the bulk of the profession don't read the S3 level guidelines that we produce, and we need to find ways of communicating with the profession. We talk about changing patient behaviour, but we have to change our own behaviour, and that involves looking at the most up-to-date evidence and starting to implement it in practice. I talk about a paradigm shift towards managing gingival inflammation for a number of reasons. There is the economic reason, again shown by the white paper by the economist called Time to Take Gum Disease Seriously, when they put an economic value on prevention of periodontitis by preventing gingivitis, new cases, incident gingivitis. So that's one important reason, because that's an important healthy economic reason. There's also an important reason because preventing gingivitis is the primary prevention strategy for periodontitis. Gingival inflammation is a risk factor for tooth loss. And then the final one, which is equally as important, is we now have evidence that gingival inflammation, gingivitis, actually has an impact on systemic health. Gingival inflammation can increase the risk of major adverse cardiovascular events and CRP levels in blood. So with that knowledge, we need to make sure that for populations that don't have access to professional care across the world, we find a way of getting the message to them, improving their health literacy. And we can only improve the health literacy of those populations if we start to work in parallel with the industry. We do it through research and clinical practice. They do it through products that they develop. Over the next decade, I think we're going to start to see a real change in the way oral health professionals sort of manage population health. Our focus has always been oral health, and it should remain oral health. But actually, we now have a role in early case detection of type 2 diabetes or pre-diabetes. We now have a role in early case detection of hypertension, high blood pressure, and also atrial fibrillation. This is recognised. There are pilot studies running that are demonstrating tremendous pickup rates, early case detection rates of raised blood pressure, hypertension, atrial fibrillation, pre-diabetes and type 2 diabetes. And I think the whole oral healthcare team needs to start engaging in the early case detection of these conditions, refer on to the medical professional, the family physician, for formal diagnosis, because they make the formal diagnosis. And then the loop closes by the family physician feeding back to us as oral healthcare professionals, okay, thank you, I've investigated it, I've actioned it, and it closes the loop. Because the mouth is part of the body, the mouth impacts on the rest of the body. And if I'm going to finish with a quote, it will be the Bangkok Declaration from the WHO, there is no health without oral health.